Hey dudes, I thought I'd record a little bit about the whole COVID thing. I'm just going to ramble. I don't have a script, so there'll probably be some ums and uhs, and I might be a little circular and all that, but I'm a little scatterbrained right now. I'm 46, so I'm not at great risk. I guess that's a good thing. And, there's medications now that we can use to sort of mitigate risk, and I've started some of those medications, and, I'm sure I'll be fine. But at any rate, I wanted to talk to you about sort of a healthcare perspective. That's my sort of day job, my real life, how I earn money. It's definitely not knife making or YouTube. I'd probably starve if that were the case. So, I have direct patient contact basically every day I'm at work. And I have to be, I guess, sort of brutally honest so far in the crisis for COVID-19, the SARS-CoV-2 virus. Things have been a nightmare, just a complete utter third world type nonsensical lot of BS. And I think you guys know this, but if you go back to, let's say, the WHO's failure to recognize the serious nature of this, I think, you're looking at a first world country like China building a 10,000 bed hospital in 10 days to house all these patients. And they're clearly making maneuvers, regardless of what they're saying. They're making maneuvers that they are suffering greatly. A first world country with world-class healthcare is getting blown out of the water. And this is in January. And just a whole bunch of ho-humming and blah, 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 blah. And the CDC, just all kinds of nonsense. I'm sure someone at some point will put together, a greatest hits for the CDC and WHO, and even Anthony Fauci over the past 3 or 4 months at some point when we get further into this. About them minimizing everything. And for goodness sakes, this was just called a pandemic a week ago. And now most of Europe is underwater. The United States will be soon. And at any rate, it's been very disappointing, their lack of action. And people are pointing their fingers at President Trump, and I think that's one narrative you can assign to this whole thing. If you're looking to President Trump to make medical decisions and guide the country medically, that'd be incorrect. He's not a doctor. He's not an epidemiologist or virologist. He did fire the guy in charge of all that at some point, I guess, and shame on him for that. But the point is, he clearly was not getting direction from our scientists and from the CDC that made any sense. And so is he to blame? Sure. Is Mike Pence to blame? Sure. Is the CDC to blame and the WHO? More than anyone, that's where I finger the blame. Our hospital systems, who had 3 or 4 months to prepare themselves, did nothing. And when I say nothing, I mean absolutely nothing. If you heard in the press, these governors and the president and everyone else talking about how we're ready for COVID, no, you're not ready. No one did a damn thing. I will tell you that as someone who works intimately with that in the hospital. No hospital did a single thing. No infrastructure was built. No ventilators were acquired. No PPE or masks were obtained above their meager stores. This while, again, China is getting blown out of the water, and there's no reason to think that it won't come to the United States, Europe, and elsewhere. None whatsoever. And yet we did nothing. We didn't even plan until about 4 weeks ago. Our hospital didn't have a meeting to plan about what we would do and policies. We didn't have any COVID orders for our EMR, so no one can order COVID testing, COVID isolation, COVID, all the stuff that you can even make a proper requisition to get someone tested for. Our state did not have tests because for some reason the CDC wanted to send out a test that included testing for MERS and SARS-1. They had extra reagents, and they were going to test for it all. They were going to test for COVID-19, and then these 2 other coronaviruses that are virtually extinct. And we were just going to figure it all out. And the test didn't work. The reagent was bad, and so we've been flying blind. In Oklahoma, I think we've done about 500 tests to date. It's very shameful. We had the capacity to do about 100 tests a day for the past several weeks, if that. We haven't been doing that many. I think 2 weeks ago, we'd done 39 tests or something like that, or 40 tests in Oklahoma. So there hasn't been adequate testing, and that's, it's really been hard to understand and sort of comprehend that. From my standpoint, it's been a real mess, a real mess. So there's probably thousands of undocumented cases in Oklahoma right about now, and we'll start catching on because people are starting to die, just like they did in Washington and New York and California. And testing capabilities are going up, but again, this whole time we've been hearing about how prepared we are, and the president talking about how many millions of tests are available, and it's just not true. It's been 4 months since this started, and we're almost no better off, no better prepared than when it began in China. We don't have enough. Our hospital has about a total of 12 negative pressure rooms. That's where these patients are supposed to go. They're scattered all over the hospital, so you can't even cohort the patients in the same area. We have enough suspected cases now that they're in positive pressure rooms, regular pressure rooms where the air is not sucked out, so that people are safer with airborne and droplet diseases. We don't have enough N95 masks, so you can't at our hospital. If a suspected case is in a negative pressure room, you can't wear an N95 mask unless they have a positive COVID test. So if they're suspected, or a PUI, a patient under investigation, but not tested positive, they could still have COVID. We just don't have a confirmatory test. Again, the states, until today, has not been doing any significant number of tests. In fact, we were told for about a week and a half we couldn't actually test. So, but unless they're tested positive, you didn't get an N95 mask. And so, now once they tested positive, you did. It's not that they are any more contagious after they tested positive than before. No one's in any more danger than before. But now you just get a mask, and before you didn't. You can't even get surgical masks. Surgical masks are on lockdown. So the whole thing is, it's very third world. It's very third world. It's been a complete, utter shock and disappointment. At any rate, that's where it's at. So I know people are hearing, again, from other voices and leadership that we are prepared, and we're not. And I think just now, as things start rolling through these different governor states that were just 2 or 3 weeks ago, thumbing their nose at COVID, I think they're just now saying, whoa, holy crap, we're in deep. And that's the total truth. I think everyone's just now realizing that there's a great amount of hubris on our part and the CDC's part, and that we're going to pay dearly. So that's where I stand. Got a tickle in my throat from this thing, and I think I've probably said enough, but I want to check in with you guys, just sort of let you know my thoughts on COVID from being a healthcare person. And, good luck, stay safe, stay in quarantine and social distancing and all that. So check with you guys later.